Then 300 COVID-19 tests were mishandled after a mass testing event at Rowe Farm last Friday. The North Dakota Department of Health confirmed the news this afternoon. Valley News Team's crime and safety reporter Bailey Hurley talked with one of the women tested who says she's disappointed.
Melissa Fry says she was one of the 349 tested at Rowe Farm last Friday, but says the Department of Health was radio silent through the holiday weekend, saying when she finally got a call late Tuesday morning, it wasn't the news she thought she received.
They said, with an apology, let me know that my test was with the group that was mishandled, and they advised me to get retested.
The Department of Health says the samples were put in a different refrigerator than normal, and as a result, the samples went undetected past the time when they could be tested.
My concern is how many of them were healthcare workers or people taking care of elderly that went and got a test and didn't get results.
Fry says she worries some who were tested at the event might have thought their no news was good news and could have traveled or gathered with large groups over the holiday weekend.
I'm angry, upset that we're celebrating these little victories that aren't victories, and we're giving the people a false sense of everything being okay. And I can tell you, in my home, it's not okay because we have COVID here and we're incredibly sick.
Fry says she's been dealing with symptoms of COVID-19 throughout the weekend, including fever, cough, and shortness of breath, but says thankfully she's not nearly as sick as her significant other who tested positive last Thursday.
He now has pneumonia and dehydration, so I'm monitoring his O2 saturation just to make sure he's not hypoxic, and once he gets to that point, I'd bring him back into the hospital and he'd most likely be admitted.
Fry says she's getting another test with her healthcare provider today and hopes the other 348 do too. In Fargo, Bailey Hurley, Valley News Live.
The Department of Health says this was the first time this has happened at the state lab, and procedures are being updated to ensure it is the only time.